Hi, I'm Eli Briggs. I'm the Government Affairs Director with NACCHO, the National Association of County and City Health Officials. And I'm here with Brad Banks, and we are going to do a role play of a meeting between a NACCHO member and a congressional staff member on Capitol Hill.
Hi, I'm Brad Banks. I'm the Managing Director of the Washington State SACHO.
Hi, Brad. Thanks for coming in today.
Hi, thank you so much. I appreciate your time.
How are you doing?
Doing well. Doing
Good.
Well. How are things up here?
Oh, things are fine. You know, crazy. It's
Yeah.
always crazy. But we're happy to see you today and to learn about issues going on back in your community.
Sure. Well, thanks for your time. We in Washington State, as you know, we have a pretty progressive public health system. Very much appreciative of a lot of the support that we get from your boss, among others, in helping us continue to be a leader nationally on public health issues. I think we've more and more tried to think about public health as a shared responsibility, not just something that is a local responsibility or a federal responsibility, but really a combination of federal, state, and local. And so I think today part of the conversation obviously is to talk about how we work with the federal government to both for funding but also for service delivery and coordination efforts.
So what are some of the biggest challenges you all are facing in Washington right now?
Well, I think no different than any other part of the country. The 5 years of recession, 5+ at this point, has really squeezed us to a point of really operating at a bare bones level. I think we, even with as much infrastructure as the state had in place, we're at a point now where we've hemorrhaged so many employees as part of the system. I think we're in a 30 to 40% reduction of local public health experts at this point. And I think as we all know, germs don't know boundaries. And so from our perspective, as we try to keep a system, local system with our state partners and our federal partners, for us right now it's really a funding conversation and really trying to ensure that we can build that infrastructure back up to pre-recession levels.
And so where do you see that playing out? I mean, I know last year there were some infectious disease issues with the pertussis outbreak. Is that an area that's still of concern?
It is, and I think the pertussis outbreak was really a good example of a system that, while I think we responded as a state very well and coordinated with between, like I said, the local, state, and even federal partners on that, I think it was, though, an example of a situation that probably expanded further than it needed to as a result of the fact that we just don't have the capacity to operate that we once did. And so, fortunately, it didn't go as far as it could have. But I think it was really a wake-up call that these reductions are really taking a toll, and that if we're going to keep our system vibrant and effective, we need to make sure we have the pieces in place for that. So, and I don't think pertussis is going to be the last of those that we see. We're seeing a very aggressive flu season this year, among other things. So.
What about, if I can switch gears for a second, what about the Affordable Care Act? Are you all involved with the implementation of ACA?
So we are, yeah. I mean, I think Washington again has taken a leadership role in trying to get a hold of that, understanding that it's kind of where the nation is moving, and we need to be part of that conversation. I know there's a lot of dialogue about its pros and cons, but I think at our level, at the local public health level, our job is implementation and service delivery, and in our state, our elected officials have taken the opportunity to put an exchange in place. Obviously, it's working very, very well. We also have a number of coordinating and outreach and access roles that local public health is playing across the state, whether it's in hospitals or in our actual departments and districts, or out in the community helping folks get the access and get coordinated and in touch with getting them insured, which is a big deal. So I think for us it's not really an issue of whether it's good or bad. It's just an issue of it is what it is, and we need to be promoting that and working for it as sort of the law of the land at this point.
Yeah. So. Great. What about, I'm hearing a lot about the Prevention and Public Health Fund. What are you all, I know the state is receiving some funding. Does that get down to the local level?
It does, and I think that's something that's very important to us. And I think at a federal level, we work with NACCHO very closely, the National Association of City and County Health Officials, on this effort, and it's something that is probably the single most important funding source for particularly local public health for the population and chronic disease work, population health and chronic disease work that we do. It's as we started off, kind of that conversation around the shared responsibility, and I think that's one of those big components that the federal government plays, is protecting. And that fund has seen reductions over the past several years, but I think we're at a point now where hopefully we can start to gain some of those losses back, and I think really pick up on doing some of the work that is so important. And a lot of those dollars that come to Washington State in particular are really specific to community work. I think it's really forced us to think about doing things regionally, doing things, doing our business in a really efficient but kind of bang for a buck sort of way. And I think we all know that if you're going to be investing in something, investing taxpayer dollars, investing them in something that gives you a broad rate of return, as many public health activities do, it's a really good investment from the federal level.
Well, I'd love to hear, if you have stories from, the local level, please, continue to share that.
Sure.
As that funding moves forward.
Definitely.
So if there was one message that I should carry to my boss, what from our meeting, what would that message be today?
So I think probably just a few things to touch on. One, thank you for the support that you've continued to give local public health and public health in general. I think two, prevention and public health fund, critical to us, critical to the state of Washington. We really, and it's not just an issue of reliance, it's an issue of making sure we have the system in place. So, and three, don't hesitate to reach out to us if we can be helpful. If you're having questions that are brought up in committee hearings that you're in, or budget negotiations or whatever, I mean, we want to be able to provide you that data, as well as our National Association advocates can do that too. So
great. Well, I really appreciate it. Thanks for coming in.
Thanks for your time.
Thanks.